My name is Matthew Distefano. I've been practicing in the field of professional mental health counseling for about 10 years. I graduated with my master's in 2006, and this field really kind of came to me honestly. My mom was in the field. She's a nurse practitioner in psychiatry, and so I grew up around it, and it was just always the thing I wanted to do. So when trying to diagnose DID, I think there's a couple of things to look for. Obviously, the research has shown that most people that have dissociative identity disorder come from relatively abusive backgrounds. So that's one thing that you're definitely going to be looking for. You're going to be looking for any kind of changes in personality that are severe enough that it may resemble something from the DSM diagnosis of DID. And the ultimate goal when you have a DID patient is what we would call assimilation or integration, where you try and get all the personalities as best you can into one cohesive unit, or at least in some examples, at least working together and not working against each other. So that's just in a roundabout kind of way, that's generally what you would try and do. So cognitive behavioral therapy is a very research-oriented technique that we use in counseling, where essentially what we try and do is we teach people that thoughts cause feelings, really. It's very Adlerian-focused kind of therapy, where a lot of times in therapy we think we feel something and then we think it, but that's not the truth. The truth is we have a thought first, and then we have a feeling that's related to it. So we try and get people into this reality-based kind of world where we realize that the world around us affects us, but we can change that by how we interact with the world as well. So we can do that through CBT, for one. Guided imagery is another technique that we use, and it's almost meditation in a way, where you walk people through certain scenes, you walk people through certain images, you try and get people to calm down, you can bring them back. It's what we would call kind of a grounding technique. So it's something that you can use to help people stay grounded, to stay in reality, and to stay in the present, and to not extend themselves into something that isn't. When you're dealing with someone with dissociative identity disorder, and I kind of have I think a unique kind of take on this, is we generally, we use these diagnoses and, we deem people with depression or anxiety and stuff like that. But when you look at people that have dissociative identity disorder, I actually think it's one of the saner things that the human mind can do. Because you look at these people and the trauma that they've been through. It's like I said, terrible trauma, terrible abuse in most of the cases. And I think a lot of us in those scenarios would do something suicidal, do something like that. And what the mind actually does is it splits, and it says, maybe I'm not strong enough to deal with this issue or this trauma, so it creates a personality that actually is. So it splits into a way that actually, in kind of a roundabout way, it creates more personalities to deal with traumatic issues without doing something totally subversive. So one of the things that you're going to try and do in the beginning is you're going to try and, first of all, make the personalities aware of each other. Sometimes they don't even know that they are. That's a very, very slow process that can be traumatic for a patient to realize that. Some personalities have greater awareness of others than some of the others do. Some don't have any idea. Usually there's a couple of personalities that kind of take control. So those are going to be the ones that you're going to want to kind of speak to. And then as you generally make them more aware of the other ones, one thing that I would try and do is try and, of course, tap into that strength, that they have been through something very, very traumatic, that they have developed these other personalities to help deal with them, and that they do have a place in the world. And as we integrate them, so to answer the question, finding out that there are other personalities and finding out generally the scope of what this is can be obviously an issue for a lot of patients. But as we work on normalizing that to the greater degree of the individual patient, then the integration process becomes, a very healthy process for them, as we realize that what other people might deem sickness or mental illness was a coping mechanism for us. If you have a question about whether you might be suffering from some kind of personality disorder, or someone in your family might be suffering from some kind of thing, I think the very first thing I would ask people to do is to seek treatment. I think that, again, I know I try to normalize a lot A lot of things happen to us. We go through a lot of bad things, and we deal with them in a lot of different ways. So if we can normalize them, if we can get somebody to treatment, if we can make them feel like they're not alone, if we can show them that there are other people out there that suffer from the same kind of thing and that there are success stories, I think that that's the most positive thing we can do therapeutically.